As the pandemic continues, we're learning more about new treatments to help us survive COVID-19 and endure through all this. And joining us now to discuss Paxlovid and vaccines is infectious disease Dr. Stephen Threlkeld. Good to see you again, Doctor. We're so glad to have you with us today.
Hey, Joe. Nice to see you.
All right, well, let's talk about President Biden to begin with today. He's back in isolation after testing positive again for COVID-19, and he used Paxlovid for treatment. Can you help us understand what Paxlovid is and how it works for those of us who don't know?
Yeah, it's called a protease inhibitor, a class of medicines we have a lot of experience with through HIV, and this is one that works against COVID. And what it does is after the virus makes copies of itself, it prevents that virus from putting those pieces together and packaging them so they can go on and infect other cells. It's very effective when taken early, as a lot of antivirals are. It's why you're really supposed to take it within 5 days of the onset of your symptoms. The problem is that some people have relapsed a bit, had the so-called rebound. That happened, it's important to point out, in both the Paxlovid arm and in the placebo arm of those experiments. So it's not Paxlovid causing it. It's simply Paxlovid does, at its current dose, doesn't necessarily prevent all of those cases, though it is uncommon for that to happen.
So who can use Paxlovid and how can you get it?
Yeah, so it's been expanded, I think, very appropriately. There are a lot more places. There used to be just a couple of pharmacies locally. Now very many can. And not only can healthcare providers, physicians, nurse practitioners, but now pharmacists can actually give the medicine when you test at a pharmacy and show a positive test. You really need to be somebody who is at higher risk for severe disease, over 65, obese, diabetic, or other kinds of heart or lung problems. Those are the people that have been shown to benefit. And since pharmacists really do a great job of looking at medication interactions, that's the one thing that you need to look at, because this drug can interact with other medications in important ways.
All right, can you help us understand how it's possible for someone to test negative one day and then positive another day after using the Paxlovid treatment?
Yeah, I mean, there are two things. Number one, the test is not terribly sensitive. These tests are great when they're positive, but not so reliable when they're negative. They're not terribly sensitive. So it really could be that that negative was a false test. But in fact, there are those who suggest that Paxlovid might need to be a longer course than what has been approved. So it may just be that not all of the virus was flushed out, and you really do have a bit of a rebound where the virus really does come back a bit. Thankfully, it's almost always mild, and it seldom requires any additional therapy. And indeed, it's really not approved for any additional therapy, though if you're antigen positive, you can probably give it to someone else. So it's important to go back into isolation if you are, in fact, positive on the test.
Let's talk about long COVID for a moment. What are the most common issues people are seeing as it relates to long COVID? And do you know if treatment like Paxlovid helps with those symptoms?
Yeah, that's a hard one. I mean, there are so many aspects of long COVID. I mean, the most common ones that I see in my practice are simply kind of fatigue, sort of the brain fog that you hear described so much. We see a lot of blood clots that have occurred, some occasional heart problems, heart rhythm problems. I've even seen very strange neurological problems, people developing stuttering in their 60s or 70s who've never had it before when they had COVID. So there are a lot of things that can happen in the long COVID. We're only just now beginning to understand that. The hard part about the medicine is it's not totally clear that medicines like Paxlovid, or at least it's not clear how much they do to prevent that. More work needs to be done for us to really know that for sure.
Well, Dr. Stephen Threlkeld, always a pleasure to reconnect with you. Thanks for sharing your wisdom with us on this Monday afternoon.
Thanks, Joe. Good to be